So welcome to our first webinar in our new Catalyst Youth Mental Health webinar series on data and measurement. So the first webinar, we're going to talk a little bit about why data and measurement matters across across a broad group of stakeholders who you get to meet in just a minute. And before we dive into our panel today, we're going to hear a little bit about the Catalyst Youth Mental Health Grant and what sort of the context that this conversation is being set in, and where we've come so far within the grant, and what we're hoping to achieve with this webinar series. I'm joined today by Jay Shaw and Clifford Ballantyne and Julia Parrott, and Udoka Akupolwakwi. Am I correct, Udoka? And I'm going to moderate, and my name is Alyssa Frampton, and I'm the coordinator with the Catalyst Youth Mental Health Grant. As I mentioned, I'm going to pass it over first to Jay to introduce himself and talk a little bit about the grant, and then I'm going to dive into, I'm going to ask the other panelists to introduce themselves, and we'll dive into our questions. And really, we're here today to have a discussion about data and measurement, and what we mean by that is thinking about what are the different types of ways we collect data when youth come to services. What are the types of ways we share back data? When are we collecting data, in what contexts? How is data collected and informed by different lenses, such as an Indigenous lens, such as gender equity, and then broader also how it's reflected back into research and into learning health systems and so far. So those are just some of the things that we're thinking about when we talk about data and measurement, and this panel is really here to start setting the context, and each panel subsequently, or each webinar subsequently, will talk a little bit more, dive in on some of the focused areas around data and measurement, both across Canada and also internationally. So Jay, I'm going to pass it to you to introduce yourself, and then we'll go from there.
Super, thank you, Alyssa. And it's great to be here with my fellow panelists. Nice to see old friends and also to meet new ones as well. So my name is Jay Shaw. I'm a clinician scientist based at McGill University in Montreal and the Douglas Research Center, also affiliated with McGill in Montreal. And I've been a clinician for over 10 years and a researcher for almost as long, really focused on the area of youth mental health and early intervention services. In a range of different domains, ranging from early psychosis all the way to kind of broader youth mental health service transformations, economic evaluations, and conceptual models of the ways in which mental health problems develop into illnesses and recovery can and should emerge. And I say all of that because I think it allows me to share kind of a series of different perspectives I have. I have not just one hat as a clinician, but also a different hat as a researcher. And I think many of us here, both in the audience as well as on the panel, probably share multiple hats as well. Let me start by talking a little bit about where the catalyst came from, because we could present it here as, here's what the grant is and here's what the grant does as a broader project. But I think it's also important to acknowledge the history, which is that around 2014, 2015, supported by CIHR, which is the funder of this grant, as well as the Graham Beck Foundation, a number of initiatives related to what we now call integrated youth services emerged across Canada. Some of which were provincial service-based initiatives, others were research initiatives, and yet others were knowledge translation and mobilization initiatives. And as a result of these kind of sprouting up, one after another, but largely at the same broad time, there was an urge and an impetus to get people together to have conversations about the fact that, well, they realized they were collecting data that was going to overlap both in the folks who were coming in seeking care and seeking supports and services, but thinking ahead that there might also need to be some alignment and agreement about what should be collected and how. And so those early conversations about coordinating and standardizing what we collect and measure in the context of integrated youth services were sort of a key starting point. And then a CIHR grant opportunity emerged in the summer of 2019, which galvanized and brought people further together. And then, of course, in 2020, the pandemic started, and the landscape has evolved dramatically since then in terms of the ways in which services and supports are delivered. But the need for data and measurement and conversations around that remains. And so that brings us kind of to now. The Catalyst was awarded. We've been working hard to develop and launch a few initiatives. There are a number of folks involved, both those here as well as others who were key to putting the submission together. And along the way, people have told us things like the fact that different stakeholders have different levels of knowledge and varied perspectives about data and measurement, not just what should be collected, but how and why, and how it should be presented or depicted. So that's one kind of broad theme that we'll pursue over a series of these webinars and the project as a whole. A second is that organizations and initiatives, of which there are many now, need opportunities to gather and share knowledge and best practice around data and measurement in youth mental health. And third, there are so many initiatives happening, both in Canada and globally, that it would be a shame not to highlight these so that they can learn from each other. And it happens that the Catalyst is a network grant, which means that its primary goal is to bring people together in conversation. So we're really excited to launch this webinar series that does just that. Today's is the kickoff webinar. And so rather than covering a specific project or initiative, we wanted to really start by sharing a series of perspectives across stakeholder groups on data and measurement. And Alyssa, I know that we have a slide here that really talks about what we do in a few kind of bullet points. One is that networking and knowledge sharing in order to strengthen data and measurement capacity, to identify best practices and ensure that those are circulated and mobilized. And in doing all of that, to strengthen the capacity for both research and evaluation. We have a number of partners from across Canada, both academic institutions, but also youth mental health initiatives, and we thank all of them, as well as our funder, CIHR. Can we go to the next slide, Alyssa? So just to give people a high-level overview of what the project is doing at the moment. It's composed of a core team that includes researchers and early career researchers, a youth advisory, a family advisory, and an Indigenous group as well. And the objectives on the other end, so to the far end of the right end of the arrow there, really I covered in the previous slide. But to do so, we are trying to build both an initial set of projects, but those that'll converge into a series of flagship initiatives and projects in their own right. So some of those include a real push on Indigenous services data and an outcomes framework for capturing or gathering data in youth mental health that adheres to OCAP principles and kind of equity, diversity, and inclusion principles, and is done in partnership with Indigenous communities and representatives. A second flagship being the idea of a learning hub for data and measurement across youth mental health. And there will be more to come. In order to kind of work towards these, we have been having youth meetings of Indigenous communities and representatives, a partnership project with a national training entity, which is a SPORE-funded project or a patient-oriented research project. And we're developing a project with them. A project led by Dr. Gina Dimitropoulos, based in Alberta, on youth mental health data and needs around that in post-secondary institutions, how data is collected and what data is collected across youth mental health services, and so on and so on. So a series of projects that are all kind of clustered around different aspects of data and measurement in youth mental health. Alyssa, I think that gives kind of a broad overview of where things are at now, and hopefully gives people a feel for the sorts of things we're doing. We look forward to hearing if people have feedback or thoughts or want to get involved. Do reach out. And with that, I'll hand it back to you.
No, thanks, Jay. I think that's great. And I think that we just wanted to share a little bit about what the grant is and how we kind of got here. And this leads us into, moving our conversation forward today. So thank you for that. And I'm going to go to our other panelists to introduce themselves before we dive into the panel. And I do want to just mention that folks can put questions into the chat, and we can, as we go, and we'll have some time at the end. So I'm going to go to Clifford, and then I'll go to Julia, and then to Udoka. So Cliff, off to you.
Hi everybody, I'm Cliff Ballantyne. Thank you for coming to share some time with us today, and we'll talk about the work that we're doing and some of the work that we want to do and some of the considerations of doing this type of work. I've been involved in this type of work for the past 9 years. I came in as a person with lived experience, living in an Indigenous community. And over my time being a part of this stuff, I found myself in some interesting roles along the way. And a lot of my work now highlights a lot of the Indigenous spaces and how to engage, as well as that youth perspective, as well as now I'm a former young person, but I'm a huge advocate as a former young person of people coming into this space, and how do we mentor them, but also how do we mentor new researchers that want to become allies within the Indigenous lens of our work. And so my current role is with the Saskatchewan Integrated Youth Services as the manager of youth and caregiver engagement. And yeah, I'll pass it over.
Thank you. My name is Julia Parrott. My pronouns are she, her. I'm located in Charlottetown, PEI, traditional lands of the Mi'kmaq. I currently work as a youth and adult trauma therapist at the PEI Rape and Sexual Assault Center. I'm also working as a mentor with Frame's Knowledge Mobilization Fellowship. I have a master's in counseling and spirituality, but in that master's, I did my thesis on knowledge mobilization. So I feel like I come into this space both with kind of an intense academic relationship to knowledge mobilization, and having worked in the community in addiction settings, trauma and various community settings, understanding the gap between research and our lived experience working with youth, and just a real appreciation for what knowledge translation is trying to do. And so, yeah, I'm just excited to be here and hear what folks have to say. Thank you.
Okay. Good morning, everyone. My name is Udoka. I'm originally located in 36, the land of the Métis in Saskatchewan, Saskatoon. I'm a researcher, but I also have been trained in family medicine. I'm a family physician, but I've been doing a lot of research since I came into Saskatoon. My research interests are around participatory research, youth empowerment, Indigenous health, medical education, and primary care. I'm very keen on data management, data use, and data stewardship, especially within the framework of Indigenous data sovereignty and governance. And so that is what I'm hoping to bring into this space. Cliff is a very good old friend, and is also my research partner because we work together at Sturgeon Lake, and it's part of my PhD program as well. So yeah, happy to be here and contribute and learn from everyone.
Thanks so much, Udoka, and thanks, Julia and Cliff. It's great to have all of you here. And so I think let's just dive right into our questions. The first question that I'm gonna put out there for you all today is, how did you get involved in the youth mental health sector broadly? And then also, why do you think data and measurement is important in this sector, or why is it important to you? And so I'm gonna go to Julia first, and then I'll open it up the space for others to respond.
Yeah, thank you. So I got involved with the sector, I think mostly because my most impactful relationship with the mental health system was when I was a youth. I have a chronic illness, And learning to cope with a chronic illness at a young age opened my eyes up to how everyone around me is struggling. And as an innate caregiver, I took on that caregiving role. And as time went on and I went to school and studied psychology, I realized how important youth mental health is and how it can really change the trajectory of someone's life, and how it really changed the trajectory of my own. And so ever since I started, in the field of psychotherapy, I have really wanted to keep a focus on youth. So that's how I got into this field. And why I feel like data management is important, I think kind of speaks to what I mentioned earlier in my introduction about there is such a gap between the research that is happening at institutions and what we experience on a day-to-day level. And I think it's common knowledge that there's a 10-year delay in what happens on the ground. And it just, as someone who, has lived through the system in different ways, both the medical and mental health field, the physical and mental health field, it is very frustrating to think that we can't make these gaps happen quicker and more efficiently, and especially from a youth perspective, in a way that is meaningful for youth, and not just, the adults in the room telling us what we need to do and how we need to do it. I think a lot can come from getting youth voices heard, and, in conversations that have happened, it is also just a challenge to make youth feel like we value their opinions and that they're wanted and needed and how important it is. And yeah, so I just think there's a lot of space for conversations, and and that's where I feel like this conversation around data management, although maybe sounds clinical, is really about trying to capture what it means to live today in our various contexts, and how can we translate that back to the institutions that are doing the research, and then translate back to the interventions I'm doing in my office, for example. So that's my piece.
Does anyone want to jump in next? Thanks so much, Julia. Those are great points.
Yeah, I can jump in. So I got into the youth space initially during my early engagement with youth in middle schools here in Saskatoon. So I would volunteer to teach, sometimes volunteer to help with youth that were struggling, especially the schools that were more Indigenous populated. And there I found that youth struggled a lot with mental health, struggled with fitting in. And I tried to reflect my own, time as a youth, in middle school, if these were similar struggles that I faced, and how to mitigate them. And that was what got me interested in youth mental health. Initially, that was what I was pursuing for my thesis before COVID hit and we couldn't meet in person, but it's still one of my passions. And then to the next question, why data is important. I always like to speak from the lessons I've learned from engaging with Indigenous people. Data is important because it preserves history for them and it's their identity, right? So a lot of historical antecedents has shown how injustices have been meted to Indigenous people in Canada. And so a lot of strategies to deal with the issues that Indigenous people face in Canada have been coming more from a non-Indigenous lens. And so data management is very important to inform those gaps that come from their own perspective, owned by them, and is informing changes that they could sustain. So yeah, that's what I can add. Thank you.
Yeah, for myself, I think I mentioned it a little bit earlier, is that I come into the space with my lived experience, because I also was a young person that didn't necessarily have a way forward. And so through this work and through engaging in this work, I found the importance of my voice and how to support other young people and other young Indigenous people, trying to get within this space. But, essentially, yeah, I just found myself looking for a space to be able to share my voice, and this was one opportunity that I actually didn't realize that I could do that in. And through talking with researchers and other people within the space, it's just like, well, we do want to hear you, we want to hear your thoughts. And so, I think that's what makes me kind of the advocate that I try to be with a lot of the spaces that I fill within the research lens. um and I think what's important about data and measurement, when you're looking at it from Indigenous lens, is that it can impact long-term funding within our communities, of showing like these are the changes, these are the positive things that are happening within community. And in community, it's always trying to find better and more resources for our communities, and how we're moving forward and getting past some of those traumas that we experience, and looking for more for strength-based ways of moving forward. And like Yoko was talking about, with the sorry, I lost my thought a little bit. But just the importance of, like, oral language. Not everybody understands what the oral tradition of how we move forward. But if we're putting that in a research context for knowledge translation, and if it's done through OCAT principles, through a meaningful relationship, I think you can better sustain the importance of the work that we're doing, not just in community, but outside, and how we advocate for more allyship and more collaboration amongst non-Indigenous peoples.
Thanks, Julia, Udoka, and Cliff. Alyssa, would it be okay if I shared a little bit as well? All right. So, I shared at the beginning that I'm both a clinician and a researcher, and of course we all wear, many different hats. Cliff, for example, you mentioned that you're Indigenous, as well as, when you first got involved, you were a youth as well, right? So we all bring multiple perspectives. In my case, I found kind of in the course, or I realized more than I ever had in the course of my clinical training, that I really loved working with young people and thinking about and talking about well-being. And so that was kind of this intuitive piece for me about why I wanted to do work in youth mental health. But then I learned a lot about what we call the epidemiology of it, right? So that's a fancy word with lots of syllables. But what I mean by that is this realization that it's really in young people that mental illness first has its onset and the early course is set. And what that means then is that if you want to make a difference for young people in long-term trajectories, you got to get involved early, and you got to build things early and intervene early. And that, for me, laid out all sorts of questions about the how. So data is going to be essential to answer questions about the how. And when I got my hands dirty in designing and developing services, that I saw the value that data could bring in advancing things, as well as, like, firsthand, the challenges in collecting and analyzing and interpreting data, right? So that continues to keep me pretty engaged and charged up. And I have what I call good days and bad days. So on some days, I sort of wake up and I think that there's been a lack of data historically in mental health settings. And sometimes I think that on my good days, that's because there's been a lack of training or opportunity. And then there are bad days, meaning days when I sort of wake up on the other side of the bed and I worry that the end result of this, the end result of the lack of data, if that persists, is that people and organizations aren't going to be accountable to end users, right? Which in this case is young people and their families and communities where they're located. So that is something that keeps me sort of fired up. And at the same time, it's been clear, especially through the pandemic, that how data is collected and measurement is captured has really changed dramatically in a short period of time. So those are some of the issues that I'm really sort of engaged with these days and are very important to me.
Thanks, Jay, and thanks you all. And I think some of the things that I'm hearing that I think are kind of coming up consistently are, I think, Julia, to your point about the 10-year gap, I think, quote unquote, I think that that's something that we're seeing in terms of like getting that feedback from, what is happening, what are our service users, young people, as Jay said in this case, what are they saying about the services, and what experiences are they having in their care, and then how are we actually getting that back in to researchers and to policymakers that are making decisions about the types of care. And then to Clifford's point, a lot of times we don't get to have the time or the attention to things like Indigenous sovereignty, like Udoka spoke on, and who's collecting what, and how is this valuable to young people, when things like Clifford mentioned, funding, are tied also up in the types of data we collect. So it's complex, and there's a lot of people who are involved and players involved in thinking about what are the types of data and so I think conversations like this and thinking about who is collecting the data and how it impacts each of us in all of our different roles are the types of conversations that help us get to thinking about what types of data we need to collect and how we move this conversation forward. So the next question that I have is why should and Jay, you kind of just mentioned this about caring about data, but why should youth and service providers and researchers, family and caregivers think about data and measurement? Why does that matter? And so Udoka, I'm gonna go over to you first with that question.
Yeah, it's like saying, and this is just me trying to be silly here. A physician, for example, is useless without sick patients, just like a researcher is useless without data, because that's what make them have those titles or play those roles. So data is important for the kind of work that we do as primary care providers, researchers, program planners, and all that, because like we already mentioned, Jay already mentioned in the opening slides, they inform decisions, and we're going into that era of evidence-informed decision making, where you're not just making things off the fly, but they're informed by data that has been collected, cleaned, and properly analyzed. I like to see data as not just zeros and ones, a binary code, but from an Indigenous lens, stories, and history, because that is what it's about, and not just anything about them, but even their lands, even their names. For example, we can see how it's been difficult to get justice for lands that were stolen from them or murdered and missing Indigenous women, because their data was used inappropriately, and we don't know what happened. But yeah, data in that sense, it's important for informed decision making. Also for monitoring and evaluation, like Cliff said, long-term funding. We need that to monitor the programs that we're doing and see, are they making progress, or where the gaps are and how we can improve on that. Also, data could tell us patterns and trends, depending on how it's analyzed, to tell us if we're making progress, if we are not, and inform strategies that could mitigate these gaps. Yeah, so I'll stop here and let someone else chime in if they have any other thing to add.
I'll jump in. Udoka, I feel like you really hit on something that was coming up for me both in the last question and this question, and it was that for underserved populations, it's really hard to ignore numbers. It's really hard to ignore that, for example, I'm a youth trauma therapist. My role is a year old. The island is small, but youth have been experiencing sexual assault for as long as it's been happening, but there was just a critical amount of data that allowed for funding for my position. So I just think that if we can really push on getting the research to support the need for services in underserved communities, I think also about rural communities, it really, you can't ignore that. You can't push aside the discomfort of, we've been ignoring our missing and murdered Indigenous women. We've been, you can't ignore it when you're faced with the numbers. And when we talk about confronting decision makers and politicians and policy writers, it's data is a really hard fact to say, hey, like this is the story and this needs to be addressed. And this has been going on for too long. So yeah, it's my thought.
I could add to that, and that's very right on saying that, and and um and probably this is going to come in as a question. I think my problem with that is we rely a lot on numbers, and they're good, but at the same time we forget that um um quantitative versus qualitative data have the roles they play. For example, I work more in the space of indigenous people, and we have things like sample size. There has to be this particular sample size for these data to make sense or to be considered meaningful. But indigenous people don't see things like that. Even if it's just one participant they have in their research, that data is as valid as having something that fits an epidemiological framework. And so it's about seeing things from this holistic lens. There's also the idea that data is only useful when the p-values are significant, or data is only useful when the trajectory is going up. But indigenous lenses see balance, see collectivism, and not individualism. And so these holistic pictures should also be taken into consideration when dealing with data and issues around data, because if we want everyone's voice to count, even when the worldviews are kind of different, we should find that common ground to create that space where power is centered and everyone's voice makes a difference. Yeah.
If I can just chime in here, Udok, I love the point you made, which, if I can paraphrase it, and correct me if I'm mistaken here or misunderstanding, but it's almost like different forms of data or different types of data can be useful for different purposes, right? And it's possible to think about this in both from the stakeholder perspective end of things, in that different stakeholders may have a different view of what matters, what doesn't, how data should be collected, et cetera, which is certainly answers this question: why should folks think about data and measurement? But it's also that different kinds of data may be useful for different purposes. Julia had this great example of how data can sometimes be needed to highlight a particular issue or bring it to the attention of policymakers, for example, bring it to the attention of the media. There are other, kind of focused examples about how individuals may interpret data in certain ways, but they actually need to think about that kind of bringing together the way data is captured with what data is actually captured in order to be really generative in how you interpret it and in order to move the needle in turn. And then there's this beautiful point, Udoka, that you made, which is that we need to think really carefully, and we can only do this with lots of different stakeholders at the table, about what counts as data, right? So, if you said the word data to the next person you met walking down the street, they'd probably say something like, yeah, that's like numbers, right? But Dr. Chris Mushwash, who's another member of the Catalyst Grant, and has an Indigenous background, made this wonderful comment to me a year and a half ago, which still resonates with me so much, which is that stories are data too, right? They're a different form of data, and narratives are a different form of data still, but they're still data in different ways and shapes and forms. And we should come to learn how to value all of those for what they can bring.
Yeah, I just want to kind of build off what you're saying, Jay, with some of those, like the tools, like the Columbia suicide rate. One of our colleagues, Lacey, would talk about how that tool in Indigenous context doesn't necessarily is not helpful for our community, because it's just like when they go to that questionnaire, it's just like, oh, well, have you thought about suicide? It's like, I think for a lot of people in the community, yeah, we have thought about suicide, but it doesn't necessarily make us suicidal, and how that translates back in the knowledge translation piece of the work. And so I think it's more about being intentional about what you're saying about being intentional about the conversations and how we're asking questions and what exactly questions are we asking. Are they going to be deficit approach, or do we want to build on the strength-based approach of answering some of these questions? I think one of the challenges, and what Doko was talking about earlier, is I think is that from an Indigenous lens, we do things collectively, but it all comes down to like the community impact. And if we're asking young people about these questions, they don't necessarily understand of like what the community impact of that data that we're trying to collect. And so how do we get to a space to understand that, it's going to be a meaningful experience for them, that like what they're telling us, relates to them in some way. And so, yes, we do have our knowledge translation piece, but actually how do we do that in a more meaningful way so it reflects their experiences around this, community impact piece.
I think these are all very great points, and I think really starting to draw out that more on, there's the data that we're collecting, and Cliff, you pointed to like there's the specific tools that we're using to collect, and what are the types of questions there, and what's the context that we're collecting that questionnaire or that information, but then also what are we how are we moving that into a research setting, into a policy setting, or into that setting? And then how is it that that's sort of, I think Jay, you talked about the interpretation of it, but it's like, how is it that even what's written on the page is the data that we've collected to be interpreted? How is that already shifting or changing perhaps the narrative if the questions that are asked already are not, kind of to your point, Clifford, maybe the right questions or framed in the right way to have the numbers that really paint the story that we would maybe get if we had, to Yudoko and Chris's points, that actual narrative piece. If we actually had the story piece, we might hear something different than what we were seeing from the numbers created coming from, say, that survey, the suicidality survey that you mentioned, Clifford. So please continue to add any questions that you have in the chat, and we'll come back to this shortly. And I'm slightly reframing this question, this next question, Jay, because I think the last question we're going to look at is we're going to talk about issues a little bit further. And I think we've drawn out some of the issues and complexities already. And I'm wondering if we can maybe think a little bit about some of the opportunities. And I think Catherine has made a statement in the question, in the chat, saying, more of a statement than a question, that data is important in creating informed change in care delivery systems and policy with the intent of improving patient outcomes. We've talked a little bit about the opportunities, but maybe we can talk a little bit more about what those opportunities are and what's been working well. And then we'll kind of talk a little bit more about some of the additional concerns we see moving forward. So my question is really, what's been working well, and what are some of the opportunities in data and measurement from your perspective, and what's happening in the sector so far?
Alyssa, did you want me to maybe take an initial go at that?
Yeah.
So, because I think you mentioned my name earlier.
Yes.
So, I think I mentioned earlier that the field has changed pretty dramatically over the last few years. And here are a couple of examples of that, right? So there are now major data coordination activities and initiatives happening. And that could be sort of within a province, which has decided to say, hey, everybody within the province who's working in this space should be collecting data in the same way so we can better understand what the needs of our population are. It could be happening across the country. For example, there are conversations happening about at the Canadian Institutes for Health Information, for example, about what indicators to use to understand better how early identification is working in service settings in the same way, kind of across provinces and territories. And then at the global level, so there have been international coordinating agencies, but also funders, research and clinical funders, who've come together to suggest that people in different parts of the world should at least be using some core metrics or core indicators together, so that if we need to, we can learn from each other, because we can compare apples to apples, right? And so some of those conversations were not even close to happening 5 years ago, and it's changed really quite dramatically. So I'm heartened by that. Where I think there's an opportunity, and I think this next bit may speak to Catherine's point, is that a lot of the conversation is about what we collect and how we collect it, and that needs to continue and sharpen. But I think we need to also start a parallel conversation about how the data that is collected gets depicted and maybe shared and utilized. And that could be also at a lot of different levels. Like one is shared to the end user. So if it's clinical data, sharing it with the young person and their family to help them better understand how things have been going. And we need to do a much better job of understanding the best ways to share that data, how to even initiate the conversation in a manner that's welcoming and inclusive rather than making it sound overly technical, things like that. And then thinking about how to do that at the level of the individual in the clinical encounter, but also at the level of the service, at the level of community, to understand better what the needs of the local population are. Which can then in turn be communicated, Catherine, to your point, to policymakers in order to make resourcing allocation decisions, for example. So I think that is probably a new, not new, but it's an area that's really poised for growth if we start being able to collect data at scale, to be able to answer questions that have been on the tips of our tongues for a long, long time. And if we can advance the ways in which we do that to make sure it's inclusive, to make sure it includes youth, family voices alongside other stakeholders, I think we'll get a lot further along in meeting the priorities of the people we're supposed to serve.
Thanks,
I
Jane.
strongly
Okay.
echo. Okay.
Go over to you, Doku. No, go. Please go ahead, Yudoko.
I strongly echo everything Jay has said. You know, it's something I'm also working on. So one of my key areas that I'm working is on indigenous data sovereignty and governance, and these are issues that, well, not issues. These are some advances that have been made that are welcoming amongst the community, and I totally echo that. We're now getting to an era of open science, open government, and open data, open access, and all that. And so it's incumbent and important that we should take some of these things that he mentioned into, but at the same time, remembering, you know, and I'm going to speak again from an indigenous lens, because most of what I say is what Cliff has taught me and some things I've read on myself on my own. From an indigenous lens, we should always remember the data, the questionnaire that we're collecting, is it relevant to the community that we are? Did they request that it should be collected that way? And who owns it and who controls it? You know, so that is a very important question, because data to indigenous people, it's a relationship. The OCAP principles tells us that ownership is the relationship a First Nations person have with their information, and I think of it as my name is owned by me, my pronouns are owned by me, and I don't, and if I'm sharing them with someone, I'm giving them the consent and the power to be stewards of that, but they don't own it. And so having that at the back of our minds help, you know, advance some of these concerns that we've mentioned, because there is a tendency, or there's a tendency to believe that because I'm the PI for this project, or because I'm collecting the data and it's in my possession, I own it. No, as a participant in research, as a partner in any research, the data is still mine, because it was given to you by my consent. And so the stewardship to that data should, how do you now inform and translate that knowledge you've used with my data back to me? And that's where stewardship comes in. And so, yeah, I think that is one of my, 2 cents that I can add based on the knowledge and experience I've gathered working with this community. I work with a community that they love research. Sturgeon Lake First Nation, they love research, but they want to be able to drive it themselves. You know, they want to be able to to use the data in a way that reflects their culture and their norms, and that is, displayed in the TCPS2, Chapter 9 of the ethical considerations for doing research with First Nations, Métis, and Inuit people. And so when we are coming with that, research mindset, we should also come with that relationship mindset that we're doing this, but we're actually partners in this, so that whatever you feel uncomfortable, you tell me and we'll make it work for you. Because if research is done that way, we advance reconciliation and we advance, wellness and data sovereignty and governance amongst Indigenous people. So yeah.
Yeah, and I think one of the challenges about that is how, like, people talk about the pan-Canadian data set and how we evaluate youth mental health. But what does that look like for Indigenous communities? Because we don't do things from a pan-Canadian perspective, because each nation has their own relation to Canada and their surroundings as well. And so that's something that we need to look at. Is there some common sets that we can go around? But I think it's going to be more of like a peer review or some kind of scoping review to kind of establish what are tools currently being utilized.
Yeah, and I think I'm gonna roll off of something Jay had said in a different perspective. So on the other end of data collection, when it's being communicated back to the youth, right? Because that's the whole point, is we want to collect this data so that we can better serve youth, whether that be through interventions or through programs or, but I think something that comes to my mind and how so often data has been communicated is in like a top-down. It doesn't consider the person and where they're at and how they're experiencing the information. And so what does it look like to consider not just who the knowledge user is, but where they're at and what else is going on for them? If they're at the intersections of society, how is that going to impact how they interpret the data? If they're, a certain war is happening in society right now that is impacting their particular diaspora or culture, how does that impact how they're receiving the information? I think, it can be really powerful to both be aware of how folks are where they're at when receiving information that will then inform their inclusion and eagerness to want to contribute to the data moving forward, because they've really felt themselves be seen and validated and heard, or their needs been met in some way that feels authentic to them. Yeah, that's all I'll say.
And to that point you just mentioned, that's where relationships come into play. I'll give a story and about some of the feedback that I got from the youth that were involved in the project. And so the question, who is collecting the data? What framework are they using? Does this reflect our values? And can we trust that this data is going to accurately represent the truth of what is happening in our current situation, like you just said? And one of the youth says the reason he doesn't like to be involved in surveys and all that is because they take a metric from a Western perspective without consulting them, and they bring it to evaluate them when they have their own metric for evaluating health, wellness. And we know this already, wellness is what Indigenous people call health, because they see things holistically as a balance between the four components of the medicine wheel. And so we should always have that in consideration, that when we are designing questionnaires and all that, we should be reflexive and cognizant of their culture and their values. Because when trust is lost, the participation rates drop down, because they know that this is not going to help me, so why should I be involved? So that's where relationships comes in. I'll stop talking.
No, that's I think a great point, Yudoka, and I think actually leads into the last question that I'm going to ask, because I think you're thinking about, that trust, you're thinking about the relationship, and what the last question I'm going to ask is, beyond just what data to collect in services, what are the other things that we want to be thinking about when we're thinking about, data and measurement? And so, for example, like the privacy, the trust, the relationships, what are those other things that we want to be thinking about? So I'm going to go over to Cliff first, and then we'll kind of do the rounds, and please add in any final comments if there's anything that you also want to kind of add in here. This will be our final question.
I think around some of the stuff is, how much is too much when we're asking young people, and how much tools we're using is like, I remember my first experience on some of this was a 48-page document filled with all of these questions, and it's just like, that's not like, I'm not going to fill that out, and I don't expect any of my peers to be able to fill that out. So then we had to really crunch it. The research team at the time had to really crunch it down into more digestible tools. But also, I think, some things to look at when you're starting to, think about doing like a grant, or you're getting ready to, write a grant, is like, how much time are we putting aside for engagement? I think, and I know that researchers have a lot of crunch time when writing grants, but it's like, how much time can we allocate to be able to, navigate more engagement within our research? So maybe it's 3 months or 6 months that we put aside to engage either, our Indigenous communities, or youth, any population that we're doing some type of research on, just to build some more of that trust, so they're able to lean into research with a little bit more curiosity, rather than a standoff of, why do you want this, so anyways, I just want to add that.
And I wanted to add one quick point, which I think is that links really nicely back to Julia's point in the beginning about closing some of that feedback gap and that feedback loop between what's happening on the ground and what you're experiencing with youth in services on a day-to-day basis. When you're engaging service providers, when you're engaging service users in lived experience in the research and developing the research questions, it's more likely that those questions will be informed by what is actually, mattering, what's happening on the ground. So I thought that was just in my brain linking right back to, Julia, your comment in the beginning. So do others want to chime in? I'll kind of I think I'm gonna go to you, Jay, next, and then we'll continue.
Sure. I guess what I was thinking in light of the question was about, I mean, I'm a vegetarian, but the analogy that's coming to mind is like hitting multiple birds with one stone, right? So it's really important that when we talk to policymakers, who are often really closely connected to like the folks who are funding services in the first place, that we understand what their obligations and responsibilities are. And sometimes those kind of overlap with, but are not quite the same as the responsibility, for example, of a researcher or a clinician. And so those of us who are designing and delivering services and capturing data in its many different forms, I think should bear in mind that when we create it, aligning those perspectives, or at least understanding the intersection of those various perspectives, can really kind of create synergies. And I'll give an example of Access Open Minds, which is a pan-Canadian youth mental health service transformation project that was funded by CIHR and the Green Back Foundation. And that is something that collected data at the level of individual youth and wanted to track individual youth to support them in their individual journeys. It also collected data at the level of the service. But for policymakers, when we design the economic evaluations, which are going to be forthcoming now, we really needed to put ourselves in their shoes and understand what are the things that they care about. They care about whether we've changed the configuration of services, the ways in which services are delivered, where services are located, and have we moved the need for services away slightly, even from more intensive acute settings like emergency departments and hospitals, back into communities which are closer to where people are. And that really seemed to move the needle. And so we had the task for us was to mobilize and identify data and analyze it in a way that both spoke to the project, but also spoke to the perspectives and obligations, the policy level perspective of those policymakers, sorry, the population level perspective of those policymakers. I don't know if that helps with respect to the original question.
Yes, I totally agree with what you said. Because of how vast data is, we have to translate that knowledge to what is relevant to the several stakeholders, and just piggybacking on what Julia said, the youth should have a different knowledge translation process that is different from the policymakers, the researchers, the clinicians, and all that, because data is so vast, data is so vital, and if it's going to be used and relevant, it should make sense to the people that are reading it or making sense of it. So yeah, if I'll add any concluding thoughts, it would be the mantra that I always carry along anywhere I go. Relationships matter. Relationships are the foundation of any program, evaluation, any research, because the precedents that we set the tone for what the future is going to be. So if we start well, there is a long-term sustainability outcome that we're going to get out of that, and these relationships, regardless of the level they are, should be transparent and built on that trust of the vision that is ahead of them. And this is something that I've come to learn working with Sturgeon Lake. They just lost their health director, and I was speaking with the chief a couple of weeks back because we attended a conference that we presented together, and I asked her, are things going to change now that the health director of 30 years is gone? And she said no, because we have a one-eyed vision. Everyone sees, and so everyone that comes in, even those that are going to be employed from outside the community, see the vision, and no one is going to come with an agenda to want to change that vision. And so I think that would be my concluding thoughts. Having that oneness of vision. I know a lot about IYS because Cliff tells me a lot and sends me links and all that. I know that IYS is a person-centered, youth engaged, powerhouse, and I believe that is going to go a long way in setting a tone and a precedence for others to model after. And so yeah, that would be my concluding thoughts. Thank you.
Thanks, Udoka. Juliet?
Yeah, I think the one thing that's coming to my mind to wrap up my thoughts on this are, I'd also be curious to, again, the therapist perspective in me is, how are the youth, after we refer to them to collect data, and to Udoka's point about relationships, how do they feel after we left? Like what resources do we leave them with? What follow-up information do we leave them with? What, do we let them know, articulate how much, what they can expect from the researchers? I just think it's, of course, there's hopefully always not accountability, but resources given to the youth for their time. Like, let's not take advantage of the youth that we're referring to for this data. So yeah, I just think just approaching it with care, and that these, again, they're not data points, they're human beings, and they're lending their information and their knowledge, and how can we respect that after we're no longer engaging with them? Yeah, it's my last piece.
Thank you so much. And I think a lot of what and I think Jay, you answered and Udoka both on this answered the question that we had in the chat about policy makers. And I think a lot of what we've heard here is that there are a lot of those pieces about building relationships, but also how does it are the ways we're collecting data always in situations where there is those trusting relationships, where we have relationships built, or maybe that's not the case in every situation, since not everyone's certain community-based care looks different, and oftentimes the way that we're collecting data at different service points looks differently. And Udoka, you just mentioned IYS, and we've talked a lot about standardization and collection, and I think a lot of the hopes are that maybe through different models and through different avenues like integrated use services, we can have more of those conversations for like furthering about what's being collected and what might maybe standardization might look, or data sharing. And I think Cliff and Udoka, you brought in both really great points about thinking about whose voice is included in that and who gets to have ownership over that data. And I know, Julia, I maybe I'm hallucinating whether or not we brought this in now or in our conversation earlier today that was so rich also about data and measurement. But I know we've talked also about the way that, when you're offering services, sometimes being able to point to certain data, and the way that sometimes makes young people feel connected or feel like they're a part, they're not alone in different ways. So there's all these different ways that each of us relate to data and feel about data and have ownership over, or want to have ownership over data. We didn't even really dive into this conversation about privacy, which is something we'll hit on in other conversations in subsequent webinars. So thank you so much. I think this was a beautiful way to start this conversation and to kick us off. And the subsequent webinars that will come up, it'll be monthly. It's going to happen every second Friday. And the next one will focus on I'm not even going to tell you in this moment because I'm going to tell you the wrong thing. But the next one's going to happen 2 Fridays from now. You can register through the same. If you've registered for this webinar, you'll receive the information anyways. And if not, you'll receive. You can register through youth. It's like bit.ly/YMH, and then it's just whatever the month is. So this was for NOV, next month will be DEC, and then JN. So if you type that in for each of the months, just /YMH, it'll come up with each month. And you can always email me, and I'm going to share my information on the screen so that you can contact me if you want to get the recording for this webinar or for subsequent information to join the additional webinars. And yeah, I just want to thank our panelists once again. This was super exciting to get to be a part of this conversation with each of you. I'm really grateful for you all joining us. And yeah, thank you again. I know we're 2 minutes past time, so I won't keep you any longer.
Thank you, everyone, and thanks, Alyssa, for moderating.
Yeah, thank you, everyone. It was a learning experience for me. Enjoy the rest of your day.
Thanks, everyone. Take care.